Hi guys, so in this video I'm going to talk about the anatomy of the recurrent laryngeal nerve, and I'm going to mainly stress upon the surgical landmarks. Those are the anatomical landmarks which help you identify the recurrent laryngeal nerve during surgery or during total thyroidectomy. So if knowing this anatomy and knowing these details will help you prevent injury to the recurrent laryngeal nerve. This topic is particularly useful for surgical postgraduates who are conducting and assisting total thyroidectomies, and also for MBBS students, particularly final MBBS students, because this is something that's always asked in the Viva, especially when you get a thyroid case. So before I talk about these surgical landmarks, I'll like to give a brief overview about the nerve itself, and then we'll talk about the landmarks in good detail. So firstly, why is it called recurrent or a recurrent laryngeal nerve? So it is called recurrent as it retraces its path cranially. So as we know, the vagus begins at the base of the skull and goes up to the abdomen. So in its journey from the base of the skull, it goes through the base of the skull, neck, thorax, and then the abdomen. So this vagus nerve, as it enters the thorax, it gives off a branch around the aorta and subclavian vessels. The vagus nerve gives off a branch which then comes back up into the neck. So the vagus descends from the neck into the thorax and gives a branch in the thorax which comes back up into the neck to supply the larynx. Okay, so RLN supplies the larynx. So this branch arises from the vagus in the thorax and comes back into the neck. So as it retraces this path or recurs in its path cranially, as it retraces its path cranially, it is called recurrent laryngeal nerve. So why does this recurrent laryngeal nerve retrace its path, or why is it recurrent? So this has something to do with embryology. So I'm going to keep it really brief here and just stick to what we have to know as surgical postgraduates, and even in your final year, this is more than enough. So all you need to know is embryologically, this recurrent laryngeal nerve is associated with the fourth aortic arch. So it has a close relation to the fourth aortic arch. And this fourth aortic arch, it gives rise to the subclavian artery on the right side. So the right subclavian artery, and it forms the arch of aorta on the left side. So the left fourth arch becomes the arch of aorta, and the right fourth arch becomes the right subclavian artery. So, and the vagus nerve is related to these. So that is why the left vagus nerve, if you know the anatomy, coils around the arch of aorta, and the right vagus coils around the right subclavian. So embryologically, it is related to the fourth aortic arch. So the fourth aortic arch descends caudally, and along with it, it drags the recurrent laryngeal nerve, which then again goes back up or recurs in its track. So embryologically, it's dragged down and then it goes back up into the neck. So that's the brief understanding of why it recurs and why the left is associated with the arch of aorta and right with the right subclavian. I'll talk about it in detail in the next slide. So before we go into the details of the path of the recurrent laryngeal nerve, I'd just like to say that the recurrent laryngeal nerve is a mixed nerve. So what do you mean by mixed nerve? Mixed nerve means it has all three components: a motor component, a sensory component, and an autonomic component. So the motor component of the of this recurrent laryngeal nerve supplies the intrinsic muscles of the larynx. Okay, so this is one line I want you to remember. All intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve. All intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve, except the cricothyroid, which is supplied by the external laryngeal nerve. Okay, so all intrinsic muscles of the larynx, all muscles of the vocal cords are supplied by the recurrent laryngeal nerve, except the cricothyroid, which is supplied by the ELN or the external laryngeal nerve. Okay, so most importantly, the adductors and abductors, and particularly the abductors, the ones which split the vocal cords, are supplied by the recurrent laryngeal nerve. If you want to know more about these laryngeal muscles, there's another video and you can go watch that. So the motor supply of the larynx is from the recurrent laryngeal nerve. It also has a sensory component which supplies the infraglottic larynx. So what does this mean? So you know the larynx is divided into three parts by the vocal cords. Okay. The region of the larynx above the vocal cords is called supraglottic. The region around the vocal cords is called glottic, and the region below the vocal cords is called infraglottic. So this infraglottic region is supplied, the sensory supply of this region is by the recurrent laryngeal nerve. Okay, clear. Next, it also has autonomic function. So we know that the vagus nerve has parasympathetic activity, and the recurrent laryngeal nerve branches out from the vagus, and therefore the recurrent laryngeal nerve also has parasympathetic activity. So motor, sensory and autonomic, hence it's a mixed nerve. Now let's talk about the path of the recurrent laryngeal nerve. So both the right RLN and the left RLN, RLN is the recurrent laryngeal nerve. So the right RLN and the left RLN both have a different path initially, and then they have a common pathway. So let's talk about the right RLN first. So like I said, embryologically, the right RLN is associated with the right subclavian artery. Okay, so remember that. So let's look at this image and discuss further. So here, now I'm going to draw in red. This red, what I'm drawing is the path of the vagus nerve. It's going down the neck into the thorax. And once it enters the thorax, it is initially, the vagus nerve is anterior to the right subclavian. So here, just to give you an idea, this is the right subclavian. This is the right carotid. This is the brachiocephalic artery. This is the left carotid and this is the left subclavian. Okay. And this is obviously the arch of aorta. So coming back, the right nerve descended into the thorax, and around the right subclavian vessel, it coils and goes upwards. So it coils around the right subclavian. So the right recurrent laryngeal nerve passes inferior and posterior to the right subclavian. So all you need to know is it curves behind the subclavian, passes posterior to subclavian to go back into the neck. Now coming to the left side, which I'll draw in green. Okay. So again, you can see the left vagus nerve ascending down through the neck, and then it enters the thorax. It's anterior to the arch of aorta. Okay. The vagus runs anterior to arch of aorta. And at this point, it gives a branch which coils upwards and goes into the neck again. This is the left recurrent laryngeal nerve. Okay. The left recurrent laryngeal nerve. So it coils around or curves around the arch of aorta, and it passes inferior, below, and posterior medial, behind, posterior medial to the arch of aorta. So that is how the right and left recurrent laryngeal nerve differ. Okay. So the left is around arch of aorta and right is around the right subclavian. So as I discussed earlier, this is because of the embryological development of these things. So following this, both the right and left have a common pathway. So both of them enter the tracheo-esophageal groove. So you know there's a esophagus anteriorly, trachea posteriorly, and a groove between them, a gap between them. So the nerves run in this gap. So the right and left together enter the tracheo-esophageal groove of their respective sides. Okay, and it runs just lateral to the trachea in the tracheo-esophageal groove. So both the right and left recurrent laryngeal nerve enter the tracheo-esophageal groove and run upwards. So as they run upwards, they are going towards the thyroid gland. You can see here. So when they are going towards the thyroid gland and then they go behind it to enter the larynx, so as they are going towards the thyroid gland, they come across the inferior thyroid artery. So this is the next landmark. We spoke about the vessels where it curves. We spoke about the tracheo-esophageal groove, and next we encounter the inferior thyroid artery. So this vessel may go either anterior or posterior, this nerve may go either anterior or posterior to the inferior thyroid artery, and then continues upwards in its track up to the cricopharyngeus muscle, where it disappears. So it goes in the tracheo-esophageal groove either anteriorly or posteriorly to the ITA, inferior thyroid arteries, I'm going to say ITA, either anteriorly or posterior to the ITA, and then enters the larynx behind the cricopharyngeus muscle. Okay, and then it supplies the larynx. We know how, motor and sensory. Okay, sometimes it may divide into an anterior and posterior branch, an anterior motor branch and a posterior sensory branch. Okay, so the sensory branch is posterior and the anterior branch is motor. So RLN may divide into an anterior branch which is motor and a posterior branch which is sensory. Okay, sometimes this division is seen before the cricopharyngeus. We can see it dividing. Sometimes the division is seen around the inferior thyroid artery, but most of the times it divides behind the cricopharyngeus. So all you need to know is it terminates behind the cricopharyngeus and then it pierces and supplies the larynx. So rarely it may divide into an anterior and posterior branch. So again, the journey coils around the respective vessels, either arch of aorta or the subclavian, enters the tracheoesophageal groove, goes either anterior or posterior to the inferior thyroid artery, then goes behind the cricopharyngeus and disappears. Okay, so those are also your landmarks. So this is a pathway correlates with the landmarks which we will talk about, the surgical landmarks.